What we heard were three very interesting presentations. The first was on a new drug that can be used in acute myeloid leukemia in combination with standard chemotherapy to target using a monoclonal antibody, the leukemia cells themselves, to potentially bring about a deeper remission than what you can do with standard chemotherapy. This has the potential for not only improving remissions, but also the duration of remission and hopefully, eventually, overall survival. So very provocative early phase trials.
And then the TKIs.
The second set of presentations we saw were two studies on chronic myeloid leukemia, which did the opposite. Instead of introducing more drug, they tried to reduce the dose of standard therapies for chronic myeloid leukemia or take them away entirely in certain patients. In the study that reduced the dose of the tyrosine kinase inhibitors, the standard therapies for chronic myeloid leukemia, only a very small percentage of these patients had their leukemia return. So that has huge implications for these patients who have to take a daily medicine for life. They may be able to reduce the dose of that medicine, thus reducing side effects, and equally importantly, reducing the economic burden of taking these drugs on these patients. Many patients have to pay out of pocket for outrageously expensive medicines for their leukemia. The other study stopped the drugs entirely and then monitored patients to see whether or not they relapsed with their leukemia. What they found is that about 50% of patients relapsed after 2 years. Now, if you look at the glass as being half full, you would say, that's great, 50% of patients could stop their drugs entirely. If you're looking at the glass as half empty, you would say, wow, a 50% relapse rate for leukemia, that sounds a little high to me. The investigators were able to show that for the majority of these patients, when they relapsed, they were able to have their drug reintroduced and go back into remission. One study that's still outstanding, however, is whether these patients who relapsed and had their drug introduced again had as deep remissions for as long as they would have had initially.
And Dr. Erba described a feeling of optimism in the field of leukemia treatment. Do you have any thoughts along those lines?
I think we are more optimistic in the field of leukemia. We haven't had a lot of advances in the past 4 decades. We now have some new drugs and some new ways of targeting some of the genetic underpinnings of these diseases that may result in better outcomes for our patients.